Welcome to Dental Notes and Mnemonics. Today we are going to discuss about a prevalent dental condition which affects significant number of individuals globally, dentin hypersensitivity. We'll examine the underlying causes, pathophysiology and potential management strategies for this condition. And in this way I would be able to inculcate a comprehensive understanding for both the patients and dental professional. So let's begin without any delay. Dentin hypersensitivity is defined as a short, sharp pain that arises from exposed dentin in response to stimuli, typical thermal, evaporative, tactile, osmotic, or chemical, and cannot be attributed to any other form of dental defect or pathology. Both dentin and enamel each play a very important role in keeping our teeth healthy and functional. Hereby I am providing you the three tables which are highlighting the different aspects of dentin and how it compares to enamel. First up, let's talk about the composition. Dentin makes up the 70% of the tooth structure and it is primarily composed of hydroxyapatite with 20% organic matter and 10% is water. On the other hand, enamel is the hardest tissue in the human body, which consists of 96% of hydroxyapatite, just 1 to 2% of organic matter, and 4% of water. When it comes to the structural properties of dentin, dentin is strong, but a bit more flexible and resilient as compared to enamel. It varies in thickness, being thicker in the crown and thinner near the roots. Enamel, however, is incredibly strong but also brittle and less flexible. Dentin's primary role is to protect the tooth pulp and absorb the forces from chewing. It can also become sensitive if exposed, but it can also form the secondary dentin in response to damage. Enamel role is to shield the dentin and underlying structures from wear and decay. Unlike dentin, enamel does not regenerate because the developmental cells which give rise to enamel, that is ameloblasts, they are lost during the developmental stages only. Now we will discuss that what is special about the dentin, or what is so different in dentin that it makes it a living tissue. Here are the main reasons. The first of all, the dentin is produced by the specialized living cell called as odontoblast. These cells continue to form dentin throughout the life, as we have already discussed, unlike enamel, and it helps to protect the inner layer of your tooth. Second, it contains a microscopic dental tubules that extends from pulp to the outer surface, and these tubules they are just like a small pipes which carry a fluid or connect to the nerve inside the tooth, making the teeth highly sensitive to external stimuli. Nutrient exchange is another reason where the dentin depends on the pulp for nutrients, which maintain and helps it maintaining a healthy and functional. Dentin also has the ability to repair itself. When it is damaged, the odontoblast can produce a protective layer or reparative dentin to shield the tooth inner structure. Finally, dentin responds to stimuli like temperature changes, pressure due to its connection to the nerve tissue in the pulp, showing that it's an active and living tissue. Now we will explore how the pain is transmitted through dentin. It's a process that plays a key role in conditions like dental hypersensitivity. Let's break it down. Dentin contains thousands of microscopic tubules that run from the outer surface of the tooth to the pulp, which houses the tooth nerves. These tubules act as a pathway for stimuli such as temperature changes, pressure to reach the nerves. Whenever the dentin is exposed due to enamel wear or gum recession, these tubules become vulnerable. External stimuli like cold, heat, or even the sweet foods can trigger the fluid movement within the tubules. The fluid movement activates the nerve endings inside the pulp, leading to the sharp, short lasting pain response. This is why people with the exposed dentin often experience sudden intense pain when they consume hot, cold, or acidic substances. Pain transmission in the dentin follows what's known as a hydrodynamic theory, though many other theories has been given for dentin hypersensitivity, but the most acceptable one is the hydrodynamic theory. This theory suggests that the changes in the fluid pressure within the dentinal tubules stimulate nerve endings, causing the sensation of pain. This theory also suggests that changes in the temperature causes fluid to move within the dentinal tubules, activating the nerves in the pulp and causing pain. In case of cold stimuli such as ice, water causes the fluid inside these tubules to contract and move inwards towards the pulp. This rapid movement triggers the nerve endings and which result in the immediate sharp pain sensation. On the other hand, hot stimuli like when you have tea or coffee causes the fluid to expand and move outwards. This also stimulates the nerve, although the pain sensation from the heat may be slightly different, which you feel when you have the cold water or cold ice water, etc. Dentin has two types of fiber, A delta fiber and beta fibers. A delta fibers, A stands for A delta and acute. These fibers are responsible for transmitting acute, sharp, localized pain and often in response to cold or pressure. These fibers are myelinated and have a faster conduction velocity. As compared to A, the C fibers transmit dull, aching pain and they are unmyelinated with slower conduction. They are more involved in the deep throbbing pain associated with conditions like pulpitis. The patient with dentin hypersensitivity present as a sharp, short lasting pain triggered by hot, cold, sweet or acidic stimuli. The pain is localized to one teeth and it is near the gum line where the dentin is exposed. Patient also report about the discomfort when brushing, eating or even breathing a cold air. Clinically, there will be no signs of decay or infection, but you have to notice the enamel wear or gum recession, which may reveal the sensitive dentin. Diagnostic tests like air blowing or cold water can confirm hypersensitivity through an immediate pain response. Also, it is more common in the canines or premolars to be more hypersensitive due to their prominent position in the dental arches, and they also experience gum recession or the attrition. Of duration of the pain, then it tends to subside once the stimulus is removed. Finally, we'll talk about the management part of dentin hypersensitivity. As such, there is no single cure for dentin hypersensitivity, but several approaches can manage and reduce the and relieve the symptoms as well. We will be discussing all these approaches in the slides ahead. The approach which is usually adopted when the patient comes for the first time with the dentin hypersensitivity is to prescribe the patient the dentin sensitivity agents. Dentin sensitivity agents, they may be categorized primarily into the two categories. The first one is those where the mechanism of action is to block the nerve response, or the second category involves those agents which have the mechanism of action by occluding the open dentinal tubule. Apart from these two categories, the third category is also there. These are known as a pro-remineralization agent, which helps the remineralization of the lost minerals from the tooth structures and alleviating hypersensitivity. Desensitizing agents, they act by reducing the excitability of the nerve fibers inside the dentin. This is done by increasing the extracellular concentration of potassium ions, and thus the nerve depolarization is prevented and transmission of pain signal is not there. In this category, we have the most commonly the potassium nitrate or the potassium chloride and then potassium citrate. Some of the commonly used agents to block dentinal tubules are the fluoride agents, which include sodium fluoride or stannous fluoride, calcium compound, calcium phosphate and amorphous calcium phosphate, strontium salts, an example is strontium chloride, arginine compounds. Arginine, it combines with the calcium carbonate, and these form a protective barrier over the exposed dentin and effectively occludes tubules also. The resin based sealants can also be used as a dentin blocking agents, and these are composites which are used in the dental treatments. They create a physical barrier over the dentin, preventing stimuli from reaching the nerves. Pro mineralizing agents, they act as they restore the lost minerals to the teeth, reversing the early stages of the tooth decay and promoting the overall dental health as well. The most common examples of remineralizing agents are the fluoride agents, calcium and phosphate compounds, hydroxypeptide. In this, the nanohydroxypeptide is a great example. It mimics the natural mineral structure of the teeth, filling in and repairing areas of demineralization effectively. Then another is recaldent. This formulation containing CPP and ACP, and it releases calcium and phosphate to enhance remineralization, particularly effective in preventing the caries. Apart from these two, the bioactive glass can be used as a remineralization agent. It is a silica based glass and it is a notable type also. It releases calcium and phosphate, help to remineralization and repair of the tooth structure. Next is behavioral modifications. It can make a huge difference. Simple changes like switching to the soft tissue toothbrush, non-abrasive toothpaste, and the cutting back on the acidic foods can help reduce the sensitivity over time. Restorative treatments serve to repair or protect the areas of exposed dentin. Options such as composite resins or the dental sealants, they not only addresses the sensitivity but they also improve the overall aesthetics of a patient's smile. In those cases where the dental hypersensitivity is severe, we may require the professional intervention. The techniques like scalar, laser therapy, or in some cases the surgical option to cover the exposed root due to gingival recession may be warranted. But these interventions should be tailored to the specific need of the patient and may involve the multiple visits for throughout the treatment. If we talk about the prognosis of treatment for the management of dentin hypersensitivity, then with the appropriate treatment and good oral hygiene practices, dental hypersensitivity can be effectively managed. And in many cases, symptoms improve within the few weeks of treatment initiations only. So this is the mnemonic for whatever we have discussed till now regarding the dentin hypersensitivity. You may pause the video here and take a snapshot. So watching the video, and if you really find this helpful, please give it a thumbs up, and don't forget to subscribe to the channel for more informative content and hit the notification bell so you're always updated with the latest videos. Thanks again, and we look forward to seeing you in the next video. Thank you.